Let's talk about gestational diabetes. It sounds scary, but it's actually very common, and most importantly, it's manageable. This is about understanding what your body is doing, not blaming yourself, because in pregnancy, your body is doing some pretty wild and impressive things. Gestational diabetes starts with the placenta. The placenta releases hormones that help your baby grow, but those same hormones also make it harder for your body to respond to insulin. Insulin is the hormone that helps move sugar or glucose from your blood into your cells so you can use it for energy. During pregnancy, your placenta releases hormones that cause your body to naturally become more resistant to insulin. One of those hormones is called human placental lactogen, or HPL. HPL increases maternal insulin resistance to ensure that the baby has enough nutrients to grow. Usually, your pancreas compensates by just making more insulin, but sometimes it can't keep up. When that happens, blood sugar levels rise, and that's gestational diabetes. When blood sugar stays too high, that extra glucose crosses the placenta and goes to the baby. The baby then makes more insulin to handle it, which can cause the baby to grow larger than expected. This can increase the chances of a difficult delivery, birth complications, and hypoglycemia, or low blood sugar, in the baby after birth. It also increases your own risk of developing type 2 diabetes later in life. The good news is that managing blood sugar during pregnancy makes a huge difference for both you and your baby. Now here's the tricky part. Most people with gestational diabetes don't feel any symptoms at all. That's why screening during pregnancy is routine. But in some cases, signs can include feeling unusually thirsty, needing to urinate more often than expected, fatigue beyond normal pregnancy tiredness, or blurred vision. These symptoms can overlap with normal pregnancy changes, which is why testing is so important. Always attend your prenatal appointments because this is where screening happens, usually between 24 and 28 weeks. But reach out to your provider sooner if you notice extreme thirst, frequent urination that feels excessive, sudden vision changes, or if something just doesn't feel right in your body. Trust yourself. Early detection makes gestational diabetes much easier to manage. You can't control pregnancy hormones, but you can support how your body handles blood sugar. Focus on balanced meals that include protein, healthy fats, and fiber. These slow down how quickly glucose enters your bloodstream. Instead of eating carbs by themselves, pair them with protein. For example, fruit with nuts, toast with eggs, or rice with beans. And of course, gentle movement like walking or yoga also helps your muscles use glucose more effectively, which lowers blood sugar naturally. Just a reminder, this is not your fault. Gestational diabetes is not caused by lack of effort or doing something wrong. It happens because of how pregnancy hormones interact with your metabolism. Many healthy, active people develop it, and what matters most is catching it, managing it, and supporting your body. With proper care, most people go on to have healthy pregnancies and healthy babies. And just some reminders, pregnancy is a time of constant change, and your body is adapting every single day. Just stay consistent with your prenatal care, nourish yourself with balanced meals, and please don't hesitate to ask for help if you need it. You and your baby deserve that support. Thank you so much for listening.